I think we should start now. First of all, thank you very much for joining us, the lunch symposium from Technicalbiomed. So the topic today is about fat fillings. It's the new approach to filling the fat. We will mainly talk about the machine called Bodycheck. And today we had four topics from three speakers. The first speaker is from overseas, Dr. Kasey Sung from South Korea. He will give us elaborate about the technology itself and his experience. And we will have two other Thai speakers, Dr. Sarawalai Rakchart and Dr. Atchima Suwanchinda. So I think for both of them is the very early pioneer of Thai doctors who perform this machine. So they will also share us with their experience and all their techniques for an adaptation for Thai patients. However, since I will have to run to the other room for speaking in other symposium, so let me introduce Dr. Ratchathorn Panchaprateep, so who has no need for introduction to be moderator for the whole session. Thank you very much.
So thank you, Dr. Rungsima. She has to run to another session, so thank you for coming to open these symposiums. Let's start with the first doctor, Dr. Kasey Sung. He is from South Korea. He is a plastic surgeon that working a lot on the liposuctions and fat fillings. Today he's going to talk about the fat body jet and the fat grafts. So everyone, please welcome him.
Yeah, it's a good time to enjoy lunch though, but I have to go quickly to enjoy your time for lunch. And my topic is really gonna be fat grafting surgeries. So many think about those, how to make fat harvesting and fat grafting issues, but there's not a single machine that is related with how to make a good material that to be grafted. So anyway, let's review those issues of fat grafting. You may see there's a lot of issues that you may enjoy for the grafting. Even though you may think about only fat that over face, there are a lot of areas you can feel with fat tissues. And anyway, fat tissue itself is not only fat globules. It is composed of many different things together. And as you do know well, those are basically it's some cells. We call them as some stem cells or SPF, or some extracellular matrix together, and fat globules that we can see, and many factors that we cannot see, but they have many numerous effects when moved together with the fat tissues. So we should decide to the purpose of fat grafting. So this is sometimes combined though. So it is for the purpose of skin rejuvenation, or for the purpose of volume replacement, or correcting those depressions. Maybe it's combined mostly, but fillers only do the space occupying, just filling those depressions or volume replacement only, but fat tissues do a lot more than those fillers do. And as you do know well, fat tissue is very soft and fragile. And maybe you wanted to suck out as strongly as possible those fat tissues, but that's not good issue for those soft and gentle fat tissues. So it's very fragile and should be free of germs, very easily infected. So should be very careful to harvesting those fat tissues. And it is mixed with the variable sizes, and it's easily compressed and absorbed. That means that when you make too much trauma or something, and even though when they are taken, there are some natural course of fat tissues. When they lose body weight, those grafted fat tissues gonna shrink in size. When they got weight, there's an increase in size. So they're gonna waxing and up and down for the weight change, with the change of body weight. And that's the characteristic of fat tissues. And when we harvest those fat tissues, we should be very careful to control those trauma of those fat tissues we're grafting, because without much trauma, they can survive much better than under much pressure or something. So the atmosphere of this suctioning, those vacuum, should be a little much lower than you do the liposuction surgeries. So that's why liposuction and fat harvesting is a little different procedures with such a kind of vacuum, and they are much Usually, harvested fat tissues are mixed with those blood cells or fibrotic materials or oils together. So we should get out of those unnecessary components for the fat grafting. But Bodycheck is providing optimal conditions when you're harvesting those fat tissues. Don't worry about such a big trauma for the fat tissues. So the Bodycheck provide continuous change of local anesthesia. Continuous chances of local anesthesia. So when you perform the tumors in the local anesthesia before harvesting, you may find out some areas do not anesthetized as well as you might expect. So you have to infiltrate again and again sometimes, but you do not have to worry about when you want to work with Bodycheck. You may provide continuous irrigation and harvesting chances during the harvesting processes. And it also provides the unnecessary elements washing out period itself. The lipo collector itself a container has some devices that's correcting fibrotic materials, and during the process of a continuous irrigation, they have chances of the washing out those red blood cells and those unnecessary oils or something that you do not use for the fat grafting. And those small trauma is much guarantee for the better survival of those fat tissues, and it is very closed single kit system, so do not worry about much infection or something. So let's just review briefly how to make harvesting. Actually, it is the video that I made for the fat grafting to the breast. So this is initially infiltration of tumor center solutions. So the job the doctors should do is delivering the solution evenly as possible, all the areas and all the layers you want to do the job. Yeah. I'm sorry, I cannot move the video clip with my. Can you make the video progress a little faster? Make it in the middle. Just stopped, right? Sorry. Yeah, anyway, let's go further. And there are many questions about doctors. Where is the best favorable donor site for the fat grafting? My answer is that anywhere you can harvest easily and safely without much damage of fat tissues will be a good donor site. But doctors do not want to make a donor site as arms or axilla, because even though it is not contraindicated for the harvesting areas, but there is not much fat tissues you can harvest, and there's much fibrotic tissues, so you cannot get good contents of fat tissues for the fat grafting. And there's another issue is for anesthesia. When you perform the anesthesia for the donor site or even the recipient areas, sometimes it is not easy to do those jobs under awaken. So many doctors want to do the job under sedation or general anesthesia. Yeah, sometimes general anesthesia is too serious for those procedures, but you may need the tumor center local anesthesia basically for the donor areas. Or when the patients are under sleeping, it'll be much easier to make the local nerve blocks or local anesthesia only for the recipient areas. Anyway, when you use the Bodycheck, you can do both those jobs very easily and effectively, because you can continuously irrigate those tumor center solutions to the areas of that do not covered by local anesthesia, and continuously irrigate those materials to wash out unnecessary elements. So that's why it's much easier for the doctors to harvest those good material for grafting. And when you perform the surgery on the local anesthesia only, there is a lot of problems you have to consider because of the pain or discomfort during the procedures. And that's why those for the donor areas, the Bodycheck will gonna work effectively than the awakened procedure for the awakened procedure. And how to prepare those fat tissues that could be grafted. So you should minimize the air exposure and contamination and unnecessary trauma. And those unnecessary elements like red blood cells and fibrotic materials should be eliminated before you graft those fat tissues. And you have to transfer to the optimal size of syringes. Oh, sorry. For the grafting and check the ingredients, that should be clear enough. When I check some fibrotic materials together into the syringes that to be grafted, I usually discard those unnecessary fibrotic elements before injecting. So you should use those yellow fibrotic compacted fat tissues only that should be grafted. And I prefer the single-use disposable cannula for the fat grafting of face and make a palm grip. Yeah, when you use those finger grip, like an injection of the fillers or something, there might be some chance of the abrupt injection or some resistance to be grafted, because that filler is a very even material, so you may control the speed of the injection with your hand and your fingers. But once you use fat tissues, sometimes there's not much resistance, sometimes there is too much resistance, so making some irregular distribution of those fat tissues. So doctors wanted to, I recommend to make a palm grip. Will be much easier to control the volume of injection and to control the speed of withdrawal. And basically, when you're making fat grafting, my idea is that for all the ladies, there might be some central volume loss and lateral laxity. So we usually graft those fat tissues in the centrally, those compensating volume loss. And those skin laxity that developed on the lateral side of skin, you couldn't fix well with the fat grafting only. So that's why we need some thread lifting or other procedures combined to make a better face appearance. And for the grafting, till now I have just talked about how to get good material that to be grafted for the face, but now I'm talking about how to inject those fat tissues into the face. So doctors should know those anatomical understanding about the face. The skin of a face is not single layer, so there are many surgical layers you can divide, and the base will be the bone, and there might be some muscular structures and subcutaneous fat tissues, and that is covered with the skin. And you should be very careful about touching or damaging those blood vessels or nerves around. So you better have some ideas how to inject those fat tissues for the good results with some anatomical understanding. And there are many types to talking about the surgical plans. Dividing basically the smooth layer, below the smooth layer or above the smooth layer. And many think about those subcutaneous fat tissue or some compartment below the smooth layer or something. These three books are famous for the first one, the book from Samuel Lim. Second book is from Sidney Coleman. The third book is Safi Gang from Korea. So most of those books are talking about the fat grafting into the more superficial layers. That means above the smooth and just below the skin. Sometimes it is effective for those rejuvenation or small, so for the rejuvenation purpose or some volume restoration for the older ladies. But nowadays in my clinic or in many countries, many young ladies want to make fat grafting without much downtime. So that's why I propose a little deeper approach than those superficial approach to going to the next to the bone and minimal volume of a collection will be much helpful for those ladies who do not want to long downtime. This will be a possible candidate of entry point for the fat grafting. And there might be some adhesions that we cannot overcome with the process of fat grafting. So some of them are very superficially located connected with the skin to the deep areas. So you should understand what is those big adhesion or like simply adhesion, or it is a septum, or something. Sometimes it works as like a ligament or something. For example, some ladies want to correct those Indian bend. So I answered them, the Indian bend itself is not the adhesion. That is connected with some forced ligament to the bone. So simple fat grafting into those depressed area of Indian bend cannot correct those depression. So that's why you should place those fat tissues as deeper as possible. And sometimes you might need some aggressive dissection, even though it is not corrected, limited to only the Indian bend or something. Or there's a lot of areas you should discriminate when you place those fat tissues. Even though some areas are connected, like when you approach the forehead, deep enough to the bone, but when you go to the temple area, it is connected with the superficial temporal fascia. So you wouldn't go deeper when you go temple along the same plane as like a bony attachment of a forehead. So you have to understand when you go deeper or superficial. When you go deeper, it is much easier to restore volume or something. But when you go superficial, there's much more damages or much more swelling or much more chances of bleeding or something. So that's why you should discriminate which will be better. Personally, I do perform those for young ladies. I replace those volume as minimal as possible. But for all the ladies who have a very soft and loose skin, so at that time I replace more the volumes than I expected. That means that 130% overcorrection for all the ladies to restore volume and restore rejuvenation together. But for young ladies, they don't like such an overcorrection of those grafted materials because there is too much downtime. And how those grafted tissues gonna survive well? Basically, you should get a good material that could, for the grafting. And second is you have the good hands to inoculate as minimal as possible amount of fat tissues. That is originated for the theory of that simple diffusion. Once you graft those fat tissues, they do not have any blood vessels connected, as like our kidney or some heart transplantation. So they need those delivery of oxygen and nutrient by simple diffusion. It is limited to only 1.2 millimilli from the host tissues. So bilaterally, it's going to make 2.4 millimilli in distance. That means when you inject those fat tissues that is thicker than 2.4 millimeters, they cannot survive at the central area. At the peripheral area, they're going to provide by those oxygen and nutrient by the host tissues. But when you go thicker than 2.4 millimeters, the central part cannot survive well. So they're going to necrotize and absorb. And that's why I do not enjoy those bolus injection for the fat grafting. And also, many worried about much complications of after fat grafting. My idea is after fat grafting, fat necrosis happen always. They should be always fat necrosis because those grafted material wouldn't survive 100%. So those dead materials will be absorbed by our host, our own environment. But the issue is the amount and the rate. When it develops too much, it's going to make some cyst or some lumpy or other problems. But when it happens very small and minimal amount, our body going to restore and clear those necrotized material easily. So they wouldn't be make a big problem. So do not worry about the fat necrosis. It's a natural phenomenon. And when those happen very small, there's no problem. So that's why it happened some volume loss after fat grafting. So personally, I do not guarantee 100% survival of fat tissues, even though I use Bodycheck. So maybe 50% to 80% in between will be your results. It's very hard to predict those results correctly. And the timetable, when the infection happened after the fat grafting, it's going to happen in 3 days. And a week later, when there was a symptom developed as like infection, there will going to be too much fat necrosis. There is going to local inflammation, not infection. There might be some similar recurrent painful lumps months later, even after fat grafting into the face. That will be going to be some typical type of infection, or when there's no infection, you did the job clearly, there might be small recurrent fat necrosis that would not survive well, because those grafted material is much weaker than the host tissue. When you got same trauma as like a host tissue and a grafted material, when you compressed those grafted material, you're gonna got much more trauma and much easily absorbed. And the last one, that is much serious complication of a central lateral artery occlusion. It is no single way to predict when they happen and how to predict that. The only single way that I very cautious during my fat grafting, especially around the globular areas or around the forehead, around the orbit, I do not go too much resistance. When I go through those along the bone or along the skin or just above the muscle, it should be run smoothly. There should be not much resistance. But when I met too much resistance or too much bleeding when I go past through, I should be stop and try to figure out other approach, other entry point to inoculate the fat tissues. When you go have to pass through with too much pressure, there might be some serious reactions. Many famous doctors have some complications, those unexpected results. But I'm so sorry, it is no single way to cure once they happened. So just be careful. There might be some literatures as I write down, but those are not always helpful. So be cautious. And there are other options like micro or nano fat or stem cell enhanced fat grafting. That will be going to be our good issue. So I'm going to talk more about the stem cell enhanced fat grafting for my next presentations. Thank you.
Thank you very much. Thank you very much for your talk, and you give us anatomy. I think in the fat filling, anatomical knowledge is very important. The next speaker will be Dr. Sarawalai Rakchart. She is an expert in the dermatology surgery and laser. She is now the managing director and the medical director of iSky Center Clinic. She is going to talk about and share her experience in using a quality technique, using fat graft. I think she is one of the first person that uses in Thailand. So everyone, please welcome her.
Thank you very much for your kind introduction. Today I'm going to share the experience that I do the Bodycheck in Thai patient. This is an early experience that I used to learn. Okay, the Aqualift, the Bodycheck, water jet, I think is the same meaning. It's the water assist liposuction. And this is my disclosure. Why I interested in fat grafting? Because when I finished training the fellow in dermatology surgery, I has learned many things. But one day when I working, I look back on my table and I see this. A lot of filler. And my mentor, Dr. Rungsima, in her talk about filler, she always say that don't inject more than 3 or 4 filler per session. You need to divide in second session. So, but somebody need more than 2 or 3 cc. So I think I missed something. The thing is the fat transfer. And at that time, the fat increasing in popularity. Some of my patients always ask me, hey, do you have the fat transfer? And this is the confirm that the fat transfer is increased in popularity, because in the PubMed publication you can see that there is a lot of paper increasing the exponential graph here in about past 10 years. Not only for the rejuvenation or cosmetic, but in growth in another field in medicine, because the fat cell has a lot of stem cell. And from that time, I start to learn from many experienced doctors. And yesterday, I have learned from Dr. Kasey Sung. Thank you very much. You share so many experience. From heavily learning and training, I think this is the simplified summary that I can tell you. For the newly in fat transfer, I think you need to understand that liposuction for fat graft and liposuction for body contouring is quite different. For fat grafting, you need to use the viable fat cell to graft, and you need only the small volume if you inject on the face or on the hands or the small area. So the viable fat cell, you need to harvest it like very gentle or trauma. But it's different from the body contouring because you do the hard work. So the volume that you need to extract may be like a lit or 1 or 2. And no matter fat cell die or not, you just throw it away. So you can do any suction that help you easily suck the huge work. And another thing is the time limit, because fat graft, when you pull it up out of your body, it has the time to survive. So you need to re-inject it as quickly as possible. And this is the step of the fat transfer. Every step determines successful fat grafting. The first step is fat extraction. It refers to the viability of the fat cells. And when you have the viable fat cell, you need to process it before you inject to the transplant site. At the process, the viable fat cell will survive much or less, depend on this step too. And after that, when you get the good cell from these 2 steps, you need to re-injection it. The re-injection is also important about the retention rate that Dr. Kasey told you already. Okay, move to the first step, the fat extraction. If you want the good quality of the aspirate tissue, what to concern is the extraction method. The liposuction with a traumatic or gentle, you need to use low pressure, like Dr. Sung already told. It's easy for me to talk after him. And the viable of the adipocyte also refer to the viable of the another cell type like stem cell that we want to use the benefit of it. And tissue particles should less than 2 millimeter, and less anesthetic drug will increase the survival rate also. From the requirement, for me, I use the Bodycheck Eco because it answers all my requirements. It's quite different from the big machine. If you used to see this machine, the Bodycheck, the big boy here, this is for like liposuction for body contouring, and you can adjust it to do the fat transfer also. But the Bodycheck Eco is the small machine that limit the pressure of the suction, fixed at minus 0.5 bar. It's suitable for do the fat transfer. And how it works, the water assist liposuction. Because the fat cell is look like the orange, like Dr. Sung told. When you suction it, you need to if you want it gentle, you need to break the fat cell. But you break the fat cell with the water by spraying the water to lead the way, and you suction through it. And it works in the simultaneous infiltrate and aspirate like the cycle. I have the video later to show you how it works. In the first step, we will infiltrate the tumescent and wait for the vasoconstriction. And when we want to aspirate, the machine will work like spray the water and lead the tunnel inside your fat tissue, and then suction, spray the water and suction. It works like simultaneous. That's why it causes the less trauma to the tissue. Like in this photo, you can see that the connective tissue septum still intact, and this including the vessel and nerve tissue. After do the water assist liposuction, most patients will less hematoma and less pain. Okay, and the intact of the fat cell membrane you can see from this study that see from electron microscope. I think the fat cell membrane still look good. And I will show you the video about how Bodycheck work. First, you can see the spray here, spray of water. And I use the infiltrate cannula to infiltrate the tumescent and wait for a while for vasoconstriction. And after that, I will change to the liposuction cannula that has 4 lumen. If you work on 4 lumen cannula, you need to suction deep inside the fat layer, not too superficial. And it works like spray and suction the fat, spray and suction the fat. The spray will dislodge the fat cluster, and the small fat will easily suction. Oh, sorry. It's not finished the video. Okay. And you can see that the content from water jet liposuction is like, it looks nice with yellow or just pink because it has minimal bleeding. And the content will go to the lipo collector and pass the filter that will fill the unwanted tissue like the fibrotic tissue or the big particle of the fat cell. So the smooth and homogenized fat cell will be here. And you can aspirate and transfer to the saline with the closed system and proceed this to the next step, prepare it for injection. Here. It's good that it's a closed system. Is Bodycheck increase the viability of the fat cell? This is a study about the viability of the fat tissue. Here, 1 hour after do water jet liposuction, the cell viability is about 90%. But if you leave it outside your body about 6 to 8 hours, the viability will decrease less than 10. And that's the graph survive a lot. This is one of the study that with the good method to evaluate the fat survival rate in vivo and in vitro. This is some of the method that they use to describe the viability. They harvest the fat with water-assist liposuction and manual, and inject back to the nude mice. And after that, measure the weight of the fat by the time. Surely that the fat cell will decrease the weight by the time. But compared to group, the manual group will decrease more weight than the water-assist liposuction. From this, we can, and it's significant at 14 days. For this paper, we can conclude that water-assist liposuction could obtain more viable fat graft and achieve better fat cell survival. And we move to the next process. Processing is to separate the fat emulsion from the tumescent or unwanted component in the fat that we harvested. We can use the sedimentation or centrifugation or travel dry technique, but I think this technique is not that famous already. So if you use Bodycheck, you can do the sedimentation, but if you want more concentrate fat, you can do the centrifugation. The sedimentation is like you just leave it on the rack and make the gravity do its work, and it will separate the fat and the tumescent like this, and you use the fat emulsion here. So after you got the fat, the re-injection is also important because the successful of fat grafting is not only depend on the quality of the fat cells, but also the injection technique. If you can inject fat cell particle small enough, you will less the central necrosis. This refers to the publication by Dr. Yoshimura. Here, they divide the fat graft in 3 zones. First zone is the survival zone. all of the adipocyte and subcutaneous adipocyte stem cell will survive in this area. It's up to 0.3 millimeters. The second zone is generating zone. Is up to 1.2 millimeter. That's why Dr. Sung told that the fat particle should be less than like 2 millimeter or 2.4 millimeters when you inject to the tissue. In this zone, the adipocyte will die, but the adipocyte stem cell will survive and generate themselves to the new adipose tissue. And the third zone is the necrotic zone. This paper result is much like the old paper from Dr. Kapinada in 1993. The surviving zone is about this 0.5 minus and plus 0.5 millimeter. And only 40% of this fat will survive. So from the theory, I can conclude that the injection technique should be done in threading, very small droplet, layer by layer, and not use the bolus technique like you inject the HA filler. Not overfill because you need to limit the pressure inside your tissue. And this is the Bodycheck fat cell cluster size. For the electron microscope, its size is about 700 to 900 micron. Okay, I finished the lecture. So let's see my experience. This is my first case. It's very first case, and I think my technique is still not that good. I not overcorrect that much because it's very first case. So you can see that her face swelling, but not that much, and don't have the hematoma or ecchymosis. And this is another wheel. In about 3 weeks, I think her swelling is totally subside, and in 2 weeks I think it's okay, especially on the cheek area. And this is about 4 months. Even the retention rate is not that much. I think this case about 40 to 50%, but the retention rate is not equal to the patient satisfaction rate. So she liked the first injection and didn't want another session of re-injection. And this is the second case. She has a big problem on the tear trough area and cheek, like the flat cheek. So I try to inject a lot on this area, but she has the very strong ligament. So after 1 day, after the fluid was absorbed, she a bit swelling on her face, but after like 7 days, she's swelling a lot from the inflammation. See? But in 3 weeks, mostly 3 weeks, the swelling was subsided. But for her, I think she still had the swelling more than 3 weeks. And this is her about 3 months. When the swelling on this area subside, I think this area look nice than before. And this is an interesting case. Here, this is my real patient. I do the total face rejuvenation. She like quite a little bit old lady, 52 years old. And I do total face rejuvenation. This is immediately after the fat transfer. A bit swelling, I overcorrect about 30 to 40%. And this is day 1. The fluid was absorbed and it looked better than the immediate after. And this is day 2. What I want you to observe in this photo is this area. Did you see something? She had a raised pepple on the lower lip because it's my fault that forget to ask her about the recurrent herpes simplex. If you do the procedure on the face, like liposuction or ablative, laser resurfacing, you need to give the patient the prophylactic drug for recurrent herpes simplex. Here. After 3 weeks, I think her swelling is all totally subsides and she look nice here. One thing that fat can give is the rejuvenation effect. As you can see that her skin is look nice, look smoother and shining until 2 months, and I think it's until 4 months still has the rejuvenation effect. And the fat tracking rate I think is about more than 50%. And this is another case, is my real patient. Actually, she concerned about her forehead and temporal area. But for this lady, I think she needed total face rejuvenation. But I didn't touch this area because she used to inject the HA filler. And when she smiles, it has the lump on this area. So I don't touch this area. And correct the forehead, the sunken cheek, the nasolabial fold, and malleolate line. This is 1 week after do the injection. Here, 1 week and 3 months. It's here. She concerned about on the forehead. She's satisfied with this, but I think she understands that she needs to have another touch-up session. So this case going to be do the second operation soon. Other indication of face indication, like you can do on the hands, on the finger, on the scar, breast or hip, or even genitalia or asymmetric collection on the face or on the calf area. This is the photo 3 months after. You can see that on the left hand side, the non-dominant hand side, the graft taking more than the right side. After that, I always told the patient to raise the hand, not use the hand too much for about 1 week. This is another case. Okay, I finished my case. This is the cause of the volume loss because of the reabsorption of the tumescent solution, especially by water, as this liposuction has a lot of tumescent, a lot of water inside the fat emulsion if you don't centrifuge it. And it's reduced of the edema and inflammation after like 2 or 3 weeks. It had a necrotic zone, and the low stem cell will result in low regenerating zone, so the fat will resolve. Also, fat transfer has a disadvantage. A big disadvantage is the downtime and swelling a lot, and you can have the hematoma or ecchymosis. You really need to give a patient understanding because every case has a swollen face after do the procedure. And you need to have the patient who has the realistic expectation, especially in Thai patient. Don't forget to show the worst photo to your patient and take the photo before do the procedure. It has an advantage and disadvantage. This is what I choose between inject fat or HA filler. If I inject a large volume, like I need more than 8 cc of HA filler, I think the price is much alike the fat transfer. So I will give the option to the patient. Do you want to do the fat transfer? And you can do on another area like hands or on the scar. And if you can accept the downtime about 3 weeks, it's okay to do it. And it makes sense, allergy to HA filler or need a long-lasting effect, and the filler need rejuvenation effect like the 52 ladies and patient who undergo the liposuction. If patient undergo the liposuction, I think I will work with the surgeon who do the liposuction, but I just want a little fat emulsion to inject to the transplant site. But I will choose the HA if Patient need only the small volume and want the fast recovery. It's a lunchtime procedure that you can just inject 1 hour and you go back to work or do something. And on the sensitive area, like static line, the very superficial area, like static, vermilion border, I will shoot a filler. Okay, for the conclusion, this is the take-home message. For more successful of fat transfer, I think you need to gentle every step. On the first step, like harvesting, less manipulate and short the processing of the fat emulsion, and gentle injection with the small doublet should be less than 2 millimeter, and threading layer by layer, not overfill it. And keep in mind, every time you inject the viscous fluid to your patient, you need to inject with caution because the prevention is the better way to reduce the complication. Thank you very much.
Thank you very much.
Okay.
Your photos look amazing. Okay.
Okay, thank you.
Okay. Let's move back to Dr. Kasey Sung again. Now he's going to come back and to tell us how to do stem cell fat harvesting. So everyone, please welcome again.
I'm gonna want to introduce two things. I prefer to introduce by myself as a cosmetic surgeon because I do a lot of cosmetic surgeries, but my job is only pet-related fields. So only I did pet surgeries. So many times I introduce by myself, cosmetic pet surgeon. And there are some doctors asking me, what should I do when patients want for the rejuvenation of a face with a Fraxel or something, needling or together with the fat grafting? What should I make the plan? My suggestion will be going to make a Fraxel or needling of such a kind of treatment first, then make a fat grafting for the face. Once you make a fat grafting for those treatment of a Fraxel or needling or something invasive for skin, we'll be going to delay it minimum for 2 weeks or a little more to preserve those fat tissues. Now, the issue is about stem cells, actually. Stem cells that is originated from fat tissues. That means even though we inject only the fat tissues, that still have stem cells inside. So why we still correcting those stem cells more to making fat grafting together? So there's going to be an answer when you listen to those presentations. Q-graft is another machinery that is developed by HumanMed to correct stem cells. And as you do know well, stem cell has two characteristics. One is they can differentiate it. They can develop into some specific types of cells. And that means they can divide and cell mitosis together. That we call them, those two characters, we call them stem cells. But those cells we are harvesting from those fat tissues are not all stem cells. Only 20 or 30% of those cells are stem cells. So anyway, there are many origins of stem cells, but we can harvest easily from bone marrow and fat tissues and blood. The best issue is that cord blood, but we have not much chance to gain those cord blood because we do not have any chance to store them when I was born. So anyway, the two issues that will be the bone marrow and adipose tissue. The blood, even though in the peripheral blood, there's not much numbers of cells. The bone marrow, yes, it has a little more numbers of cells, but it's still limited. But fat tissues, yeah, as we getting fatty, we have more fat tissues, so we have more chance to get out of those fat tissues. So that's why fat tissue will be welcome as a good resource of the stem cell harvesting. And that's why we prefer the term SVF, those correction of cells harvested from fat tissues. It's actually heterogeneous cell population, mixed many cells. So anyway, those cells, we call them SVF or ADSC. SVF and ADSC are a little different terms. ADSC is a stem cells that is originated from fat tissues. SVF is those almost all cells that is harvested from fat tissues. So anyway, those cells will have some Parkin effect or some have unique characteristics to differentiate the many cells, or rejuvenate our skins, or encourage the environment for better survival of those fat tissues that grafted together. So also, SVF cells have some immunologic functions together. Anyway, long ago, more than 20 more years ago, many doctors tried to make fat grafting for the face, but they found out instantly that even more than the volume replacement, they found some effect of skin rejuvenation after the fat grafting. So that's why many doctors who are joining in the cosmetic surgeries, they have many meanings of the stem cells. It is now become the doors opening to the field of cosmetic surgery with stem cells together. How to process SVF? It's simple. First, you have to harvest the fat tissues under clean and sterile condition and mix with collagenase. Collagenase is cutting down those collagens and releasing the cells inside, and then centrifuge. That's all. Those cells are much heavier than fat tissues, as like red blood cells. Among those harvested material, the red blood cells that has irons, so that's why they are the heaviest one. So they correct at the bottom. Just next to the red blood cells, there are cells, we call them SVF. That cells have a nucleus. That's why they are a little heavier than water. Then above them is water, and above them is fat tissues, and the highest level is oils. So once you correct the bottom layer, we call those cells. We call them those cells as a SVF. But for the worries about collagenase, that is good material to digestion of those fat tissues, but it is well known as cytotoxic materials. So doctors want to have washout 3 times to make it clear those collagenase. So that is the classical processing of SVF correction. So manually, it can take a long time, and we have to use those enzymes together. So that's why it makes the situation much complicated. And in more details, to make a tumor-centered local anesthesia, and then we have to make a fat harvest in a clean and sterile environment. And then we have to wash out those red blood cells and unnecessary ones that are correcting those SVF. And that's why it can take a long time. But interesting enough, the Bodycheck, those at the time of a collection of those fat materials, you can do it as simpler, as easier, and much safer and effective with a Bodycheck system. So don't worry about when those materials, that means what I'm talking about, the fat tissues. Once you harvest those fat tissues with Bodycheck, the material is clean enough and even in size and good quality without contaminated with blood cells or fibrotic materials or oils. That's why it's a very good material for fat grafting, also to make a processing of SVF together. And in details, But Q-Graft is the some automatic device. It's a single unit, single-use kit only. It makes as like a tower. I'm gonna show you later. So it makes those complicated processes that I presented just now make them much simpler and easier and more convenient. So no need to wash out or enzymes and even more. It has filters inside in the cabinet of those systems, so you can use intravenously directly. So no worry about those embolism because it has already filtered with past those 100 micrometer filters inside. So let's briefly review those. Some clips. Yeah, the system at the bottom is a unit that is processing for heating those fat tissues or mechanically digestion. It's not. Sometimes you may mix with humanase, named homogenase is collagenase, or basically you do not need those enzymes. There is some mechanical at the top. You may see those mechanical digestion, so you do not need collagenase basically. But sometimes when you need more cells, you may mix with humanase, collagenase, what I'm talking. And the bottom, this big tower is one single unit. It's a disposable, single-use one. And the bottom, we're going to provide those good temperatures for the cell digestion and screening and filtering in the middle. Yeah, it's a heating time. It's going to take 45 minutes to digest with those fat tissues with mechanically, and it needs some time to digest. Once you mix with the humanase, yeah, it surely needs 45 minutes to wait to those collagenase will gonna melt down those fat tissues. And then others are gonna just mechanical, just filtering down at the second pillar and correct those fat tissues and washing out again and again. And an hour later, you will find out those waters that is mixed with cells around. Fat tissue is gonna correct it at the top pillar. Yeah, at the top of the column, fat tissues are collected. At the bottom, second pillar, there's waters only that is mixed with cells. And third, there's another filter in between. So make a series screens that is bigger than 100 micrometer in size. They're gonna correct it on second field. And at the bottom, you may got those fine cells that are size smaller than 100 micrometer in size. So you can inject directly intravenously. Yeah, this is the final product of the SVF. It's a little turbid water. It's not clear because it's mixed with many nucleated cells. So once we wanted to use the mix with a small volume of fat tissues, I recommend to make the centrifuge those SVF waters to make them volume of smaller than 2 or 3 cc's. Or you may make it directly inject to the control osteoarthritis. You may inject it directly into the knee joint or something. But when you want to use those stem cells, not mixed with fat grafting, but for the anti-aging purpose, you may inject it directly intravenously. There's no risk of embolism. Oh, so that's why we have to get concept. What is the SVF? Stromal vascular fraction. It is mix of cells, so it is a part of them. 20 or 30% of the SVF cells are stem cells. Once inoculated in a culturing beige or something, those stem cells are gonna start to proliferate adhere at the bottom of the plastic beige. But those other cells, other than stem cells, those SVF cells gonna die in 2 or 3 following days without any attachment or something. So that's why SVF correction is not all stem cells, but 1/3 of them are stem cells, and others are just nucleated cells, mixture of many heterogeneous cell populations, and together with much factors that we could not determine precisely. But it has a mixed effect of some growth factors or something, or some tissue growth factors or some epidermal growth factors together. So it's very useful for cosmetic surgery. And even though we use to start those stem cells together with the fat grafting surgeries, there are many fields you can adjust those stem cells for cosmetic surgery and plastic surgery and for dermatology purposes, especially for the scar rejuvenation or skin rejuvenation purpose. You may use directly with the PLP and stem cells together, or you may use alone with the stem cells together. But the issue of the stem cell or the SVF cells has some different kind of ideas, because even though they have many good effect for rejuvenation and proliferation and tissue restoration or something, they need some signals to be more effective functionally. So, for example, once you wanted to make a skin rejuvenation with stem cells only, I think it's better to, once you apply the Fraxel treatment at the first, then applying with stem cells will get a much better effect for skin rejuvenation, because those cells have a much potent power. They do not have much ideas what to do once they inject it into our skin. So, some stimuli to make provoking those cells, you better do the job as like a skin rejuvenation or something. They do the job much effectively than without any signaling. And we do know that for the osteoarthritis patients, for the injection of those stem cells into knee joint directly, there might be some reports of fame-free risk scores or many cartilage degenerations even. So, But many worried about is it safe to use those stem cells in my clinic? You better follow those regulations of the FDA in the United States. Many worried about those collagenase, not the mechanical digestion of cells or something. So those FDA from the United States as a controlled. Once you use those stem cells with the collagenase in your clinical setting only, there's no regulation, there's no restriction to use in the United States. It's the same in Korea too, but many doctors wanted to use collagenase to harvest more cells. Even the Q graft itself has some system mixed with humanized that is collagenase together. But my recommendation is that without collagenase and mechanical digestion of Q graft itself, we're going to provide good material and much safer and easier and faster ways to get stem cells for your use in clinically. So that's what I'm talking is that much easier for you to adjust those cells. There's other indication that I use in my clinic for the purpose of anti-aging or other modalities, but I do not guarantee those treatment of illness or diseases specifically. So there needs more studies to make it sure they have some effects for the treatment of such diseases or something. But there are some reports or papers already that has some effect of those indication of stem cells in various diseases. And nowadays, there need a lot of more studies to make it sure if the cells are effective or not. And there are many subjective changes. It's not easy to make an objective results. So I think there need more studies or to make for more specific field of trials. But careful for the cancer patients. Yeah. Thank you for your listening.
That's very nice talk. And I like when you end like just one treatment procedure may not be complete. So I think we need to incorporate a lot of practice and techniques, modality, just not to just remove the fat, but to keep the maintain of the body and tightening of the skin. We'll keep the question to the last. And since we're talking about the next procedures, we will have Dr. Atchima.
Yeah.
So my beautiful sister for 20 years. And you still look the same, Atchima Suwanchinda. So Dr. Atchima will tell us how we can use the machine to combine with the technique of fat. If you take the fat out, and how can you get the size of the body shrink even more, or a synergistic effect. Please welcome Dr. Atchima. I always wonder how you keep your figure very skinny. Want to learn about your secret and your favorite machines.
You sleep like a couple hours, then he keep you thin.
That is not the answer I expect.
Okay. So my talk will be accelerated healing and enhanced result while increase patient satisfaction with MP2 technology post-liposuction. Liposuction today is still a gold standard of fat removal. We can easily, using a conventional, just regular cannula or micro cannula to remove the unwanted fat, or you can actually combine with energy-based device or energy-based technology to improve your outcome. However, the common side effect and potential complication after liposuction are swelling, pain, and discomfort. This is like a regular or the side effect that you expect to see. And also bruising, even though, some technology claim that it's actually helps in terms of less bruising, but we can actually expect that the patient will have bruise. And also the other common side effects after liposuction are loose skin and skin irregularity, including, sometimes increased cellulite appearance. So I have solution for you. MP2 square technology is actually a comprehensive solution that you can combine the two synergistic components of energy. The thermal energy from the radio frequency and non-thermal energy from pulse electromagnetic fields, or PMF. When we talk about the multipolar technology, how it works, it's actually deliver a bipolar radio frequency at the 1 megahertz, which is actually the safe and effective frequency for collagen remodeling and also for the one to treating the fat. And if you look at the handpiece, it actually have 8 electrodes. And each electrode, we change polarity between a positive and negative poles sequentially and rapidly. So each electrode will actually emit the red frequency from one electrode to another 7 electrodes. One electrode will serve as a positive pulse, and the other will serve as negative pole. Another other 7 will serve as negative pole. So it's kind of the energy will flow between the positive and negative flow until it complete the cycles, and then it repeat again another cycle until each electrode they actually complete at least once as a negative electrode. Then it's one circle. But this is actually happen in a very, very fast. It's occurred 1 million times per second, which means that the body will accept it as like, one times go as energy of the frequency between each pair. So it's look like the energy is come at once. That's why it's making uniform and homogeneous distribution of the heat all over the handpiece at the treatment area. So it is really giving simultaneous, consistent heating energy beneath the skin. It's like 3-dimensional heating to the skin, with giving the multiple depth of the tissue with the deep tissue heating, while in the same time you actually having a pulse energy electromagnetic field together, which using a 15 hertz pulse magnetic field, 15 Gauss, or 1.5 millitesla with a pulse duration of 5 milliseconds. And those are giving a therapeutic temperatures, which is you can get the therapeutic level of the temperature within a very quick, it's a couple of minutes. You can also maintain the temperatures and cover the large area with homogeneous temperatures by using this technology. And because of the handpiece is so large, so you don't really feel the hot spot. So the treatment is so comfy, and you don't really need pre and post-operative cooling. Basically, what happened is you get a volumetric electrothermal skin heating, which is prime your dermal fibroblasts to produce a new collagen synthesis, and also to produce extracellular matrix, including eliminates the old, persisting, broken, biologically ineffective the collagen fibers. And the mechanism behind it is the heat is actually induced the heat shock protein productions. At the temperature above 44 degrees Celsius, all the cells that heat up at this temperature will lead to a positive effect on the apoptotic cleaning of the malfunctioning of a damaged cellular unit. And it also induces selective late subdermal fat resorptions without damaging of the vascular tissue components. And if you get the optimal temperatures at the 43 to 45 degrees Celsius, and you keep appropriate time, you need both. You need appropriate temperatures, optimum temperatures, and you need appropriate time. Is a key to have a success. At least you have to keep temperatures up to 30 to 45 minutes, and then you get skin tightening and also with body contouring. There is many nice peer-reviewed journals showing the efficacy of this technology. This synergistic multipolar RF and the pulse magnetic fields using the treatment of skin laxity and body contouring is shown that in all the patients show the moderate to significant visual improvement in terms of brightness and also the facial contour. And if you look at the effect of radiofrequency after liposuction, there are also a nice study showing that radiofrequency, if you're doing after liposuction, it really helps in terms of improving cosmetic appearance. And this one is a study on the flappy arms in the female after liposuction. It showed that the decrease in skin laxity and improved skin appearance. And it also very helpful in terms of it helps in the healing process. It reduces pain and edema. And RF also has effects on the fibroblasts with the heat shock proteins. it enhances the pro-collagen type 1 and pro-collagen type 3 in the human dermal fibroblasts. And you can see here with both temperature of 45 degrees Celsius and 60 degrees Celsius, it has both effects on the fibroblasts in terms of it stimulates the new collagens. And it's just different in terms of point in time, but it has effect in both temperatures. If you look at the pulse electromagnetic field with a non-thermal energy, what is actually happen when you are using a pulse electromagnetic field? Let's get to know a little bit of PMF, pulse electromagnetic fields. It is generated when electrical change carrier like electrons move through the space or within the electrical conductors. Like in this technology, there are, in the blue colors, this is showing the PMF, which is occur during the treatments. And PMF is nothing new. It's been around for a long, long time. I mean, it has been used to deliver magnetic pulse through the tissue, which is induced electrical signals which stimulate the cellular activities. It has been used in wound healing, used in bone healing, used in pain relief, used in reduced pain and edema, and used in neuropathy and neurology. So it has been used in medicine for a long time, since the 15th century. It's started to use like a magnetite to draw out disease. And then it's used like magnets over the open veins. And then in 50s, it's started to discover that this energy promotes the osteogenesis. And it also helps to repair the delayed fractures. And still, you know, on the ongoing study or use in 70 is about the bone growth. It's about the osteogenesis. In 1991, in 90, it has been proved in the United States that PMF actually helps in post-operative pain and edema in the soft tissue. And when it's going to the skin, it showed the positive effects on the human tissue. Basically, what happened is when there is an electrical current placed over the skin, it induces a magnetic field. And the movement of the ions in the dermis is creating the flow of eddy currents. And that will giving a changes in electrical potential across the cell membranes. And the flux of the ion across the cell membrane trigger a signal transduction cascade, which is occur at the subcellular level that will changes in molecules and cellular response. So the PMF, when it's get into the tissue, it bind with the calcium and bind it with also the calmodulin. And it's again bind up with the endothelial nitric oxides. And that will help to catalyze nitric oxide release. So it really helps to decrease inflammations, increase in blood flow and lymph flow in a second or in a minute. That's why after PMF you see that there is decrease in pain and edema. And also it stimulates the growth factors. Then you get more of angiogenesis, again in hours and days, and after that you get more collagens and new remodeling of the skin after days and weeks. So basically, you know, the scientific and clinical background of the effects of the magnetic pulse on the skin is you get the new collagen synthesis because there is significantly increased production of collagen by reducing of the cyclic AMP level. And also there is stimulation and production of vascular growth factors, which is mainly the FGF2 and other growth factors, which is getting, you know, more enhancement of angiogenesis, which is a new capillaries. So basically, this is the, you know, I summarize benefits of PMF as regenerative property. What happens when you expose PMF? It influences the biology of the cell, and including physiology of the cell in the body. It stimulates the early formation of connective tissue and also the vascular network. stimulate the early collagen synthesis and better maturation of the damaged tissue. And importantly, it reduces the reductive of the oxygen species productions that will give a positive rejuvenation effects of the cells. It leads to a better wound healing process. And with the regenerative properties, this is what the PMF enhance. It triggers FGF2. It induces fibroblast proliferations. You're getting new collagen synthesis, and it also promotes angiogenesis. And there's so many nice articles on the PMF effects on the on using in plastic surgery or in general surgery, that it decreases the pain and swelling. And this nice article also showed that it is a device that doesn't show, is non-invasive, it doesn't show any potential serious risk to the health, and it has a safety and a good welfare for the subjects. And there's many evidence-based use of these pulse electromagnetic field in a clinical plastic surgery in terms of it reduce, in terms of pain, and in terms of swelling. It also increased the fibroblastic activity and keratinocyte differentiations in the cells. It also helps to upregulate fibroblast growth factors and also upregulated the genes that involved in cell adhesions. When we're talking about the effects on the fibroblasts, it's reconstruct the normal skin matrix. It helps to fibroblast endothelial cell, which is exposed to PMF. You can see that it reconstructs with a better arrangement of the cells. It also has a good effect on mTOR, which is a regulatory signal transduction pathway, which is helps in cell cycle progressions and also cellular proliferations. It also has a nice, great benefit in the transfer vessels. If you look at the control and the pictures of another vessels that on PDF, you can see that it has significantly, showing extensive growth of the new capillary compared to the control group. It's really increased the vascularity, which is important in terms of the wound healing. And it accelerate normal and diabetic wound healing by increasing endogenous FGF2. So it has many, nice effects, many nice studies showing that it's helped in the surgery, like it helps in decreased pain in cesarean sections. It reduces pain in breast reduction surgery. It also helps in reduce interleukin-1. It also helps in decreasing the pain in breast augmentations and also decrease in interleukin-1. There's many nice studies showing that it helps to decrease pain and decrease swelling, increase exudate volume after surgery, also decreasing in terms of the use of narcotics. It also shown that it really helps in wound healing and collagen synthesis and angiogenesis. And when we're talking about safety, the safety of PMF has been shown that it no cytotoxics, no transforming or mutagenic activity, to the cells. And importantly, it's not only helping in terms of cellular level, but this MP2 square technology, it also have alternating negative and positive pressures. It is very helpful because it's not only helps in terms of its increased efficacy to bring up the deep subdermal fat to make your target better, but it also helps in terms of it making the flow of the airs cool down and the temperature is deep into the skin. And it also make it very comfy to the patients. And besides that, we know that when we stretch the skin, when we pump up the skin, when we stretch the fibroblast, stretching the fibroblast mechanism, it also stimulates the new collagen synthesis. So with all these features, it also helps in terms of, it helps the wound healing after the liposuctions. So My conclusion is the combination of dose of multipolar F and PMF, it works synergistically on the target tissue to have positive benefit after liposuction to decrease the wound healing, to helps in the wound healing, to decrease pain and decrease swelling, and also improve skin tightening, and also help to lysate, some leftover of the fat, and also stimulate the new collagen synthesis, so you get better textures after the liposuctions. And I would like to leave my last slide to invite everybody to 3 nice meetings. We're going to have IMCAS Asia 2018 together with the IT Camp on the July 13 and 15. Again, we always have cadaver workshop. The cadaver workshop will together with the main congress. And also, if you like to go to Italy, we have ISTS in Italy at beginning of the June 7 to 9, and DASIL in Buenos Aires, Argentina, October 31st and November 4th. Thank you.
So thank you very much for your excellent talks, as always. Next will be the question and answer sessions. If anyone has questions, please feel free to raise your hand, and then microphone will go to you. Or you can come to the microphones.
I guess everyone may be so hungry. Anyway, thank you very much to stay up till the end. Thank you very much. And I would like to thank Technicalbiomed as well for hosting a wonderful symposium. Thank you.
Thank you very much.